to the three-part video series on partnering to improve diabetes management presented by Superior Health Quality Alliance. This third video is a case study to help you use what you have learned in the previous videos regarding diabetes self-management. This recording was developed for healthcare workers who have an interest in providing care to individuals with diabetes. You may watch each video in order or based upon your interest. The objective for this learning session is to discuss approaches to empower patients to take an active role in their diabetes management. We will be reviewing a case study, and our goal is that after this, you will have a better understanding of diabetes self-management. For our case study, we are seeing Mrs. Jones. She is a 67-year-old woman with a fasting glucose today of 400. She reports she hasn't been feeling well, and she's been going to the bathroom a lot. She's complaining of leg pain, blurred visions, and says she sometimes feels dizzy and lightheaded. She has been prescribed long-acting insulin to take once a day, and rapid-release insulin to take before meals to help regulate her blood sugars. Mrs. Jones states she cannot afford her medications or her Lancets. She also mentions that due to inflation, she can only afford fast food, canned food, and frozen food. She complains of feeling down and is dependent on her family for transportation to all doctor appointments. Her medical history includes heart failure, diabetes, chronic kidney disease stage 3, and a prior stroke with no residual effects. In summary, Mrs. Jones is experiencing significant health challenges. The primary takeaway from reviewing this case is the critical role of the patient in managing their diabetes. The majority of diabetes management relies on a patient's daily choices. So let's discuss Mrs. Jones's recent experience. She was admitted to the hospital due to hypoglycemia. As a Medicare patient, she is entitled to a 3-night stay. Her hypoglycemia was likely exacerbated by changes in her medications and her hesitation to take the prescribed medications due to the high cost. Through conversations with her healthcare provider, she was reassured that the goal is to support her, not to punish her. The goal is to help her avoid future hospitalizations, to address her mental health. She was referred to a psychologist as she reported feelings of depression, which can be common among older adults, particularly those managing chronic conditions, as the combination of physical health challenges and the natural aging process can significantly impact mental health well-being. Mrs. Jones was also referred to the Diabetes Self-Management Education Support Program to access all the available resources. Additionally, Mrs. Jones agreed to seek assistance from her family for logistical support, such as attending specialist appointments and managing her medications. Even if she can address one item per month, it represents progress. She was provided education on the effects of diabetes and discussed strategies for better self-management. Mrs. Jones identified what she felt capable of doing, and that those items were the focus. The process includes shared decision-making with her healthcare provider and family to ensure she can manage her plan of care. Mrs. Jones expressed a preference to have one specific family member drive her to her medical appointments. However, that driver has a full-time job, so there's need for additional support. and this was discussed to ensure she can attend her appointments. A follow-up appointment was scheduled with her primary care and specialist doctors, and this information was communicated to the patient and her family. Diabetes self-management is an ongoing process. Effective management does not happen overnight. It is achieved through small, incremental changes and sustained commitment. Diabetes self-management can be challenging due to social drivers such as limited access to healthcare resources, financial constraints, food security, lack of transportation, and education about the disease. There are psychological factors such as depression and anxiety. Additionally, lifestyle changes are needed, such as dietary, meal plans, and regular exercise. All of these can be difficult to implement and sustain. Healthcare providers play a crucial role in supporting patients with diabetes by offering comprehensive education on disease management, providing personalized care plans, and facilitating access to necessary resources. For example, Mrs. Jones needs a referral to the diabetes nurse, educator, mental health provider, and a registered dietitian. Here's a list of tools and resources that we encourage you to explore further related to the content in this video. If you have any questions about this video series or others, please contact us at info@superiorhealthqa.org. Thank you.